Hi, I'm Christina. This is my intramuscular injection video. First thing I would do is verify the physician's orders. Then I would verify the 6 rights of medication administration: right route, right dose, right patient, right time, right medication, right documentation. I would then check the medication order in the EHR. I would do any drug dose calculations that are needed. So today the doctor ordered a morphine injection intramuscular of 6 milligrams. The drug is supplied in 4 milligrams per 1 ml. So today we'd want to withdraw 1.5 milliliters to get our 6 milligrams. I would gather my supplies, enter my patient's room, close the door or curtain for patient privacy, and perform hand hygiene. Introduce myself to the patient. Hey, Mr. Smith, my name's Christina. I'll be your nurse today. Could you please verify your name and date of birth for me? As he was verbally verifying his name and date of birth, I would also check his wristband for double verification while he was verbally doing that. Mr. Smith, do you have any allergies to any medication, environment, or food? No? Okay, great. So today I am here because it's time to inject your morphine for you that the doctor ordered. Morphine, if you didn't know, it's used to treat moderate to severe pain. This just interrupts the pathway of pain response to your brain. Some side effects you may see are nausea, vomiting, or constipation. Some adverse effects would be dizziness, lightheadedness, or a low respiratory or heart rate. Mr. Smith, you may experience also Mr. Smith, if you're experiencing any of these adverse effects, please let me know immediately. I also did want to let you know that you may feel a slight burning or stinging sensation at your injection site. That is common. Mr. Smith, do you have any questions for me? Okay, perfect. I would go ahead and perform hand hygiene, apply clean gloves. I would then want to verify I had the correct syringe and needle. So I have a 3 ml syringe and a 22 gauge 1-inch needle today. I would attach my needle to my syringe. I would want to then grab an alcohol prep pad and clean the top of my medication vial before I withdraw any. With the cap still on, I'd want to withdraw 1.5 milliliters of air. I'd want to safely uncap the needle, go ahead and insert the air into the medication vial. Okay, then I'd want to withdraw that 1.5 milliliters of my medication, just morphine. Perfect. I'd want to go ahead and tap any air bubbles out. Okay, safely recap the needle. Again, verify that we have 1.5 milliliters in our syringe here. You can see that. If I were to withdraw the medication anywhere else besides next to the patient, I'd want to label my syringe with the correct medication and dose on it, and then bring it to the patient. I would then go ahead and, since we're doing intramuscular injection, I would want to have the patient lay supine or laterally. So today we're using the ventral gluteal site. So we'd want to select our site for injection, which to do that we would need to use the heel of our hand here and place that along the greater trunchial area. Then I'd want to, the greater trochanter area. Then I'd want to make sure my wrist was perpendicular to the femur. And then I'd want to make sure my thumb was pointing towards the patient's groin. And then I would extend my fingers up the iliac crest. And then our site is going to be in between our index and our middle finger, right in the middle. So once we found our site, we then want to take an alcohol prep pad, clean that site. Before we actually clean our site, we're going to inspect the site first for muscle size and integrity. Also, we want to assess for any bruising, skin irritation, and in any edema. We'd also want to palpate for tenderness or any hardness. And if there were any irregularities, we would avoid the area and then we'd find a new one. And we also want to make sure that Mr. Smith hasn't had any injections in that site recently as well. Then we would grab our alcohol prep pad and go ahead and clean in a circular motion from the inside to the outside, about 5 centimeters. We'd want to let that site that we just cleaned air dry. We do not want to blow on it or fan the area with our hands. So once that site is dry, with our non-dominant hand, we want to use our thumb and the forefinger to spread the skin tightly, placing the ulnar side of our hand below and grasp for traction. We're going to go ahead and safely uncap our needle. Go ahead and tighten the skin, get some traction. We then want to inject the medication with our dominant hand quickly at a 90-degree angle into that muscle. Okay, once we did that, we want to use our non-dominant hand and grab the bottom of the barrel of the syringe to stabilize that. Once we have that, we can go ahead and inject the medication slowly. We want to inject the medication at about 10 seconds per 1 ml. Once all the medication is injected, we want to hold it in for about 10 seconds before we remove that needle. Okay, we'd want to release our traction, remove the needle, toss both the syringe and needle back into the sharps container. We do not want to recap that. We want to go ahead and grab a gauze pad and press it over the area with a little bit of pressure and make sure we do not massage that area. We would go ahead and apply a bandage if it was necessary. Doesn't look like they're going to need a Band-Aid. We're going to go ahead and gather, discard any trash, remove our gloves, perform hand hygiene, and then we want to go ahead and document what we did with our procedure.